There's big changes now in place for pregnant Iowans on Medicaid. Previously, those on Medicaid received 60 days of coverage after birth, but starting this month, that's bumped up to a full year. However, the change also means fewer people qualify now. So before, a family of four needed to make less than $117,000 a year to qualify for the Medicaid coverage. But under the new guidelines, Iowa lawmakers lowered that cutoff to less than $67,000 a year for a family of four. The Iowa Department of Health and Human Services estimates just under 16% of Medicaid members will now lose coverage with this new rule. That's a monthly average of 1,300 less women and 400 fewer babies receiving coverage. So why did lawmakers say the changes were needed? For that, we turn to Natalie Krebs, health reporter for Iowa Public Radio, who has been following this story for months. Natalie, thank you so much for being here with us.
Thank you.
Why don't we start? Well, why don't we start with the coverage here? What is the impact of giving people a full year versus 60 days?
Right. So this is really something that the medical community and basic statistics have kind of pushed for. Pretty much that expanded care allows doctors to kind of follow Medicaid patients for up to a year and screen for things like hypertension, um, postpartum depression, and then also even just do things like contraception management, which they say is a really, really huge change to help basically people transition into the kind of that first phase of parenthood.
Yeah, and that's something that's important to keep in mind is when you have a baby, really serious issues can arise well past 2 months after you give birth. But I also wanted to point this out. Is this true? People with Medicaid can have a higher risk of postpartum depression.
Right, yes, and that's something that many medical professionals have pointed out to me as well. The Medicaid population is a particularly vulnerable population, and there are studies and such that have pointed to the fact that they have more chronic underlying conditions, as well as things like postpartum depression. They're at a higher risk for, so things that are really important that doctors want to, continue seeing their patients for, up to a year after they've given birth, as opposed to just 60 days.
So this seems like something that's going to get more people, more coverage. We should also note here this extended coverage is being paid for through federal dollars. How does that work?
Right. So this whole thing came from basically from the federal government under the American Rescue Plan Act, offered states this additional funding if they were to extend coverage, Medicaid coverage up to a year. So this is something that basically Iowa lawmakers had to approve doing, but they're getting federal support as well to do this extension.
So let's talk about those lawmakers and the qualification changes. What were their reasonings for lowering the income threshold?
Right, so Iowa was actually one of the last states to take the federal government up on this offer and pass that. And one of the things that Iowa lawmakers kind of seem like they got stuck on is the fact that Iowa previously had one of the highest cutoffs for pregnant Iowans on Medicaid. It was 375% of that federal poverty level. So, kind of as this budget compromise, Iowa Republicans decided to lower that to 215% of the federal poverty level with this change. That being just basically to balance the budget, they said, and it put it more in line with kind of the average that we see in other states. Obviously, we saw Iowa Democrats push back against that because, that means a number of Iowa women no longer qualify for coverage under this new law.
All right, so taking all of this into account, what are you hearing from pregnant Iowans who will be impacted by all of these changes?
Right. I would say, pregnant Iowans. I have also spoken to a lot of doctors that deal with quite a few pregnant Iowans on Medicaid, and they're very excited about this because basically they say that, it is really important to have this extra coverage, especially for things like postpartum depression, that doesn't necessarily always show up within 60 days, or to manage some of those chronic conditions that are really ongoing past that 60-day point. The other thing they point out to me is kind of contraception management. What you start off with might not really work in the long run, so it's something you kind of want to work with patients for a longer period of time. So, definitely from the medical community and from pregnant Iowans, I've heard a lot of kind of excitement about having this extra coverage for them in this postpartum period.
Natalie, thank you so much for your time today and for your reporting. I know you've been spending a lot of time on this. Thank you so much.
Right, thank you.
Like I said, this is a story Natalie has been following for months, and we have linked her full report on our website. All you got to do is head to the As Seen on TV tab of WQAD.com.